It's all about modularity, and it's all about a range of different options so we can tailor the treatment to the child that's going to be effective, it's going to be safe, and also be easy for the families to manage. I think more tools in the box are always helpful. Not all hip dysplasia is the same, not all babies are the same, they have different personalities, they come in different shapes and sizes, and so we need a different range of treatments to help them. Our typical first-line treatments work very well, but what happens when they fail? I would love an option for families where we can try some different types of braces that are going to be effective, that prevent me needing to recommend surgery as the second step. So what that means is we need a comprehensive range of non-operative treatments to deal with young babies with hip dysplasia, and that's from the mildest forms of hip dysplasia to, frankly, dislocated hips. Particularly when we're talking about the modular hip braces, we're talking really about a couple of different groups of babies. Some of the older kids, where the traditional brace treatments aren't so effective or they're more difficult to use in the older babies because they're taller, heavier, stronger, they can overpower some of the traditional braces. Or the other group where you have more difficult hips. You've tried the first line treatment, but then where do you go from there? And many times we then need to go straight to surgery. But wouldn't it be great if we had other brace options that could be used in more difficult situations? And what I mean by that are hips that are dislocated. They want to reduce, the hip wants to go back in the socket, but it's just not working with the traditional treatments. So we need some brace options for those more difficult hips. So two big groups that haven't really been well addressed in the past that I'm hoping we can make some progress with in the future. In my practice, that will be the thing I'm most interested in, is will it reduce the number of babies I'll be taking for surgery? I can now manage more of those children in the clinic in a non-operative way. And of course, everybody would like to see that. The parents want to see that. I would love to be able to manage more babies non-operatively if I can. There's many situations after a complicated surgery that some of the success of that surgery depends on the correct aftercare. And traditionally, many babies we need to put into a spica cast, for example. So one thing that we're thinking of is there a way that we could sort of streamline post-operative care? They'll always have to use a spica cast, which can be a bit of a handful for parents. And are there bracing options that we could use which will be modular, easy to fit to a range of different babies of different sizes, easy for the parents to care for their child in a post-operative situation?